Respirator protection, reducing worker exposure to respiratory hazards. Respiratory protection. This training may be used to provide supplemental information. However, district-specific training is required. The California Code of Regulations included in the training: 8 CCR 5144 respiratory protection, 8 CCR 5199 aerosol transmittable diseases, 8 CCR 5155 airborne contaminants. Respirators are a type of personal protective equipment, PPE, that is used to protect the employee from airborne hazards. Respirators are often used with other types of PPE, which include, but is not limited to, gloves, goggles or other eye protection, protective clothing like gowns. Respirators that are issued to protect against infectious agents may be ineffective against chemical hazards. N95 respirators. Respirators such as the N95 are a type of personal protective equipment, PPE, that protects the wearer from airborne particles. Airborne hazards. An N95 respirator is necessary for employees who must work with individuals who have symptoms or students who require hands-on procedures and who are exempt from wearing a face cover. Employees who would typically require this level of protection include school nurses, health technicians, certain special education staff, and other employees who may be needed to perform this work. Respiratory Protection Program. Cal/OSHA requires the employer to have a comprehensive respiratory protection program whenever respirators are required in the workplace. Employees working in these roles must know how to use a respirator and understand the components of the respiratory protection program. Respiratory hazards. Respirators provide protection from a variety of airborne hazards, which include airborne infectious agents, droplets and mists, gaseous chemical exposures, solid particles. Infectious agents. Infectious diseases that may be transmitted by moisture droplets and small particle aerosols include tuberculosis, SARS, coronavirus, pandemic influenza, chickenpox, measles, anthrax, hantavirus. Workers are exposed to these hazards during the care of patients who have suspected or confirmed to have an aerosolized transmittable disease, or an ATD. Components of the Respiratory Protection Program. When a respirator is required by your employer must develop and implement a comprehensive respiratory protection program. It must meet the requirements of the Respiratory Protection Standard 8 CCR 5144. The employer is required to identify and evaluate hazards, develop a written program, properly select respirators, evaluate respirator use, correct any problems associated with respirator use, conduct medical evaluations, provide fit testing, provide maintenance, storage, and cleaning of respirators, provide training, provide access to records and documents, i.e., the written copy of the Respirator Protection Program. Written programs vary by site. The Respiratory Protection Program must be specific to your district, schools, and facilities. Work sites will vary in designated personnel who are required to wear respirators, worker responsibilities, respiratory hazards, policies, and procedures. Respiratory Protection Program Administrator. The Respiratory Protection Program must be managed by a trained program administrator. They are responsible for overseeing the program, ensuring that the program is effective, and ensuring workers are properly protected. Face masks. During inhalation, small airborne contaminants pass through gaps between the face and the face mask and the materials of the mask. Only face masks that are cleared by the FDA may be legally marketed in the U.S. The FDA approval signifies that the face mask has been tested for their ability to resist splashes of blood and other bodily fluids. Face masks help stop large droplets from being spread by the person wearing them, prevent large splashes or sprays from reaching the mouth and the nose of the person wearing them, are not designed or certified to fit tightly against the face or to prevent the inhalation of small airborne contaminants. Face masks that are not regulated by FDA, such as some procedure masks, which are typically used for isolation purposes, may not provide protection against splashes and sprays. Conventional face masks versus the N95. An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and a very efficient filtration of airborne particles. Here's how it compares to a surgical mask. Surgical mask, loose-fitting fabric around the edges, provides protection from large droplets. N95 mask, fiber cup fits tighter around the edges, metal band to form around the top of the nose. The N95 designation means that when subjected to careful testing, the respirator blocks at least 95% of very small 0.3 micron test particles. If properly fitted, the filtration capabilities of N95 respirators exceed those of surgical face masks. However, even a properly fitted N95 respirator does not completely eliminate the risk of illness or death. Limitations of N95 reuse. If manufacturer guidance on how many times a particular filtering face piece respirators can be donned is not available, the CDC recommends limiting the number of uses to no more than 5 per device. Reuse strategies. Employees shall treat reused N95 respirators as if they are contaminated. To reduce the risk of contact transfer of pathogens from the N95 to the wearer during reuse is to issue 5 N95 to each designated employee. The designated employee can wear 1 N95 each day and store it in a breathable paper bag at the end of each shift, with a minimum of 5 days between each N95 use, rotating the use each day between N95 respirators. Rotating respirators will provide some time for pathogens on it to die off during storage. This strategy requires a minimum of 5 N95 respirators per staff member. Hand hygiene with soap and water or an alcohol-based hand sanitizer with at least 60% alcohol should be performed before donning and after touching or adjusting the N95 respirator while in use or after doffing or removing. Prevent contamination to the N95. A face shield over the respirator may reduce or prevent contamination. Wearing a clean pair of gloves when putting on, donning, or adjusting a previously worn N95 respirator is recommended. Gloves shall be discarded and hand hygiene practices must be performed after the N95 respirator is donned or adjusted. Any respirators contaminated with blood, respiratory or nasal secretions, or other bodily fluids shall be discarded. Medical evaluation. Before you use a respirator, your employer must evaluate whether you are medically able to wear it. Some conditions that could prevent you from using a respirator include heart conditions, lung disease, psychological conditions, i.e. claustrophobia. A physician or other licensed healthcare professional must perform a medical evaluation that considers your health and your specific job description. Medical Questionnaire. This questionnaire is designed to identify general medical conditions that could place a worker at risk of serious medical consequences if a respirator is used. Based on the answers to the questionnaire, the licensed healthcare professional may decide that a medical examination or tests are necessary to determine if you can safely wear a respirator. Responses to the medical questionnaire are confidential and should not be shared with the employer. After the medical evaluation, the licensed healthcare professional will provide you and the employer with a written recommendation. A copy of the medical questionnaire can be found in the Respiratory Protection Standard Appendix C. Fit testing. If your respirator does not fit properly, contaminated air can leak into the facepiece and you will not be protected. A tight-fitting respirator must form and maintain a tight seal with the face or neck in order to protect the wearer from airborne hazards. Before you wear a tight-fitting respirator at the workplace, you must be fit tested with that specific model, style, and size of that respirator. Purpose. The purpose of fit testing is to be sure that the facepiece of the selected respirator fits adequately to your unique facial characteristics. A fit test is designed to test the facepiece to the face seal of the respirator. It can either be qualitative or quantitative and uses a test agent or instrument to verify the respirator's fit. This process typically requires 15 to 20 minutes to complete per person. The respirator must be fit tested before it can be used in the workplace and retested at least annually to ensure a continued good fit. The fit of your respirator must also be retested whenever you have a significant change in weight, significant dental work, dentures, facial surgery, or significant scarring of the face in the area of the seal. Fit testing continued. When you have completed the fit testing process, it's important to know which make, model, and size respirator fits your face properly and when and where you will need to wear it for protection. Prescription glasses. Many workers need to wear prescription glasses or PPE such as safety glasses or goggles or ear protection when performing a job. If you wear prescription glasses or your job requires you to wear PPE, you must wear these items during the fit test to be sure that they do not interfere with the respirator's fit. Facial hair. If you wear a tight-fitting respirator, facial hair cannot come between the sealing surface of the respirator and your face or interfere with your respirator's valve function. People with long hair must make sure it does not interfere with the respirator's ability to seal tightly to the face.
Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head above your ears. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Place fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Push inward while moving your fingers down the side of the nose piece. Note: always use two hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform the user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Pay careful attention not to disturb the position of the respirator. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head and repeat the user seal check. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. And perform hand hygiene.
Respirator maintenance. The Respirator Protection Program must provide respirator details on cleaning and disinfecting, storage, inspection, repair. All respirators must be inspected for basic function prior to each use. Reusable respirators must be cleaned as often as necessary to prevent them from becoming unsanitary. Filtering facepiece respirators must be disposed of when they become soiled or no longer provide protection. Respirator inspection. A respirator inspection must include a check of the respirator function, tightness of any connections, inspect the condition of the various parts. Respirator storage. Storage is important to protect the respirators from damage, contamination, dust, sunlight, extreme temperatures, excessive moisture, damaging chemicals. They must be stored to prevent the facepiece and exhalation valve from being damaged. Avoid carrying a cup-shaped filtering facepiece respirator in your pocket or in a bag. This could crush or distort its shape and prevent the respirator from sealing tightly to your face and compromising your protection. Reusing respirators. A properly functioning respirator can provide an effective protection for as long as the filters or cartridges work correctly. Filters must be replaced when they are damaged, soiled, they cause increased breathing resistance. Procedures. The employer must develop procedures and guidelines for storing, reusing, and disposing of respirators. Infection control procedures may require a respirator be used only once. Your site administrator will provide additional training specific to your location and written respiratory plan.